Thank you everyone for joining us today. Our first ever virtual mid-year program, not what we thought was going to be, but nonetheless we're here and so excited to have you all joining us and using the chat feature. I see it's already going crazy, so thank you guys for being here. I put in the chat just some house rules for communicating on the chat feature. I'll re-put it in there just so everyone knows, but nothing crazy, just sort of the usual house rules. Just so everyone knows, I know there's been confusion with the Zoom link and registration. So just to clear that up, the link that you get in the confirmation email and in the reminder email is the link to register in Zoom. And then once you register with your name and your email, Zoom will send you the actual link to the meeting because everyone has a different link. So we couldn't just put up one link. So just for future sessions, we'll try to communicate that a little bit more clearly, but just so you guys know, if you have any friends that are having issues getting on, just remind them to fill out the registration and then look for that additional email, if that makes sense. Okay, Dominique, I see your message here. So the link in the email is the link to register. I don't know if you didn't get another link after that. Again, we'll look into it and make sure that everything's sort of working a little bit better for the next one. But just to get us started, today our topic is advocacy. But before we jump into that, we wanted to do our board meeting. Again, super quick, just to kind of let you guys know what's going on, and then jump right into it. So I don't think I missed anything. I do have a list, but I think that was it. Just another quick note, evaluations will be sent out at the end of all 4 sessions. So even if you're only attending one, just keep an eye out for that. It'll be sent out after June 30th. So June 30th is session number 4. All right, so without further ado, I'm going to kick it off to Samantha Bunza. She is our president. I'm sure many of you guys know her. She's going to be kicking off the rest of this meeting and the board meeting section of it specifically. So Samantha, that is all you.
Hey, thank you, Sonika. Thank you everybody for joining us today. I know it's a beautiful summer day and it's the end of a work day for many. So thank you for joining our very first webinar in our mid-year program series. Today we are just going to go over briefly some board updates. Hopefully you can see this summary slide. Can I get a thumbs up if you can? Sonika, can you see that? Okay, good. So this is just a board update summary slide for you all, just some really just highlights pulled out of some of the board members' recaps for up to this point in 2020. I think it goes without saying that 2020 has been a very interesting year so far. We're halfway through, and unfortunately we would love to interact with all of you in person, but we've come to a really good medium here with this virtual platform to be able to hopefully interact the best way that we can in getting this program to you today. I just want to go over some of the 2020 successes that we've had so far. At a higher level, we've actually worked to come up with an emergency operations plan for our board and for our organization on the internal operations level. And that was due to COVID-19 and how it really forced us to really look at how we're going to provide you all as members with useful programs and outreach. And so you'll be able to find that actually on our website. I believe it's under board documents. If I got that wrong, I'll send you a follow-up and let you know exactly where you can find that. But feel free to check that out, because right now that's, COVID-19 really did force us, because we have to stay home, to redirect our efforts on the board and really find where we can focus our energy and how to get you really good quality programs. so you can look at our priorities for now until we decide that this plan is something that we can kind of go back to normal operations if we ever get there. I just want to mention also that NJSOPHE is still seeing tremendous growth. We have a lot of momentum. So we've been growing not only with our members, but also financially. So those are two areas that I wanted to highlight today. We have currently 170 members at this point, active members. Around this time last year, I don't have the actual number, but it's around 150 from last year. So we've seen growth membership-wise. We've also seen growth financially. So this time last year, our balance in our bank account was $11,922.33. And today it's $18,832.63. So that's awesome. We love seeing that. And so we want to keep that going. We want to keep those momentums going. And you know, today we'll talk about our strategic plan. Suzanne Miro is going to come after me in a little bit, but we've also been able to finalize our strategic plan as well, which is really great. And we're really excited about that. We had a virtual, a little happy hour celebrating that for everybody who worked on that strategic plan so diligently and did such good work on that. But we are really going to focus on engaging our members as we move forward. And if you have any suggestions on how we can better engage our, sorry, I'm looking at these comments here. If you have any suggestions on how we can better engage our members, please let us know, maybe in this chat box or at info@njsophe.org. That would be great. And one last thing is, if you are interested or if you've thought about ever joining our board, this year is, we have some new spots open, and we have a call for nominations in July. So if you are at all interested, have anybody in mind, would like to feel it out, have any questions about that, please reach out to info@njsophe.org as well. We'd love to see some new faces, get some, you know, variety on the board, and we're happy to see any interest there. So that would be great too. Other than that, I don't have much more to say other than let's go to Suzanne. So I'm going to stop my share screen here. I'll bring this back up after her. And Suzanne, if you want to share your screen now to present the strategic plan.
Okay, great. Can you see that? Uh-oh, am I muted? Can you hear me?
Yep, you're good, Suzanne.
Oh, okay, great. Very good. I was like, oh no, I think I forgot to click on my microphone. Okay, great. Well, thank you today for being on the call. And it's my pleasure to present to you the new 5-year strategic plan and to help provide a framework and a focus to strengthening our organization moving forward. First, I would like to give thanks to our strategic planning committee for the many calls and meetings and hours of work that it took to get this plan revised and finalized, especially with the last few months being during a pandemic. It was a little bit crazy, but this group of ladies has been amazing to work with, and I appreciate everything that they contributed to bring the plan to where it is today. So thank you to Linda, Robin, Tiffany, Samantha, Caitlin, Dominica, and Carolina. We took a systematic approach to building the new plan, first by looking at the membership survey as a starting point. The responses to the survey were used to gather feedback on the organization and gauge how well NJSOPHE is doing in various areas, and to learn more about what is important or concerning to the membership. After that, we did 2 interactive exercises at the 2019 board retreat. The first exercise was designed to get us thinking about us as an organization from a bit more of a business model by examining thoughts to questions such as, what does success for NJSOPHE as an organization look like? So, you know, what are our ultimate and desired outcomes that show we've been successful? Why will we succeed where other organizations may fail? Which is basically taking a look at what the unique value and selling point of New Jersey SOPHE is in the professional organization marketplace. We asked, who do we serve? And this is where we talked in depth about who our customer base is. And finally, we asked how people should feel after interacting with New Jersey SOPHE and our offerings. And what impact did we have on them, whether it be from the initial welcome packet we sent to our new members or the quality of interaction with the organization at one of our big annual meetings or any of the other touch points in between. Because this is really important. This is what's going to keep people coming back to us and staying engaged and wanting to be more involved, is how they feel by interacting with us. And we also spent some time talking about our values as an organization and how they align with our mission and our vision statements. And then finally, we went through another exercise where we took the old strategic plan and quickly determined which elements would be kept in the new plan or revised or gotten rid of, so that we had a good starting point for reimagining the new plan. So what we ended up with were 5 areas of focus. The first being to support current and potential members in professional development and career growth. And these are objectives focusing on a variety of professional development opportunities to increase our knowledge and skill as health educators, to provide people an opportunity to earn their CHES and MCHES credits. And we especially wanted to focus on the mid to late career professionals to keep them from dropping out of our membership, which was something we noticed was happening through the membership survey. And we also wanted to promote attendance at national SOPHE conferences through scholarship opportunities and to promote student attendance at New Jersey SOPHE events. Secondly, we wanted to focus on communication and outreach. And we determined that we would develop and adopt a formal communications plan with a focus on adding 1 new additional social media platform, as well as reviewing all print and digital materials on a regular set basis. Third is advocacy, where a variety of activities that focus on both advocating for health education professionals and the profession of health education, as well as advocating for public health issues and becoming known leaders in public health advocacy by building our relationships with other organizations. And we've made a lot of progress on this the past couple of years under Tara's leadership with this, in terms of developing these position papers, and other organizations are starting to look toward us for our work in this area. So that's something we wanted to leverage and keep moving forward. Fourth is operations and future growth. While much of this section focuses on various financial issues for keeping the organization stable financially, we also focused on increasing the diversity and inclusivity throughout the organization, as well as engaging with past presidents regularly. And fifth is membership, which is basically the life of our organization. As you heard, we've been increasing our membership, and that's something that we want to continue to make happen in the next 5 years. And the elements in this section include a membership development plan with a variety of methods and activities to work toward a 5% increase in membership each year through the 5 years. So to view the plan, you can go to this web address. It has been posted on the New Jersey SOPHE website. So I encourage all of you to take a look through the elements and see where we're going to be going together in the next 5 years. Thank you.
Awesome. Thank you, Suzanne. Okay, everyone. So next we have Tara Rice and Devangi Patel. They will be talking to us about our topic for today, which is advocacy. So Tara is a behavioral strategist and a patient engagement consultant, and Devangi is the Deputy Public Health Officer at Montgomery Township Health Department. So they're both going to be talking about, Tara is also the advocacy chair, so she will be talking about you know, what advocacy means to NJSOPHE, what we have on the horizon, how everyone can get involved if they wish to do so, and then just some, you know, advocacy around what is going on in the world today, you know, even beyond COVID and other public health issues. So they have a phenomenal presentation sort of ready to share with everyone. So if you ladies are ready to go, Tara, I'll kick it over to you. But if you need a minute or so, take your time to get set up as well.
Can you see my slides or no?
I can't. It's just a black screen on my end.
Interesting.
Try it again. We need to vote to close the board meeting. I'm sorry to backtrack.
Oh no, my fault. Sorry. Let's do that while Tara gets set up.
Yeah, while Tara gets set up, let's do that. Linda moves to close the board meeting. Can I get a second? We can do that in the chat. Dominica, thank you. She seconds. Thank you.
All right.
All in favor, aye?
Aye.
Take it away.
Aye, all in favor.
And Tara, we can see your slides now.
Yay. Hi, everybody. I'm Tara Rice. I'm the Advocacy Chair for NJSOPHE. Thanks for that intro, Sanika. I'll try not to repeat what you just said. But you know, I'm going to talk to you a little bit about the committee, some key initiatives we have going on that you can get involved in, and some specific action items you can take related to COVID-19, racial justice, and health equity. So really this is us just sharing some of our tips, tools, resources with you, but we really want this to be collaborative. Advocacy is all of our responsibilities, so we want to hear from you. What have you been doing to support public health right now? What have your experiences been like? What are you doing to promote racial equity right now? So throughout my slides, I'm going to be asking some questions, and we'd love for you to comment in the chat feature. And we'll take all of your responses, your tips, your ideas, share them back with you and the rest of the members to continue this conversation. So really, let's all collaborate here and put together really what we feel the best advocacy practices are. So a little bit about the Advocacy Committee, in case you're not familiar. Here are some of our key activities: meeting with legislators about public health policies, creating advocacy materials, specifically our public health position briefs that focus on key issues, educating our members about public health policies, advocating not only for public health, but for the profession as well, and supporting our members to be better public health advocates. So first chat question for you. Would love to know what you're looking for from NJSOPHE in terms of advocacy. What would be helpful to you to help you further your advocacy efforts? And we might not be able to address everything that you're sharing right now. Just want to set your expectations about that. But this is really helpful feedback for us to have and will help shape our efforts moving forward. So some current initiatives that we have happening. You see 4 things outlined here. We're working on a position brief, which is advocating for funding and investment in public health. We are working on some messaging for stricter regulations for face masks in public and mandating statewide contact tracing program. That will be messaging that can be used in op-eds or in email correspondence, really many different delivery mechanisms that we can use for these initiatives. And 1, 2, and 3, I just want to note, are things that we are developing in partnership with FACE, which is the collaboration of the 6 New Jersey public health organizations. But we're taking the lead on these, which is a really great step for NJSOPHE. It's an important role for us, and it's also an opportunity for the public health organizations in New Jersey to have one voice and a more unified effort. So please let me know if you're interested in helping with any of those 3 initiatives. And then lastly, we have formed a subcommittee focused on racial justice and health equity, which I will talk more about in a little bit. But feel free in the chat, if you want to say, hey, I'm interested, shoot me an email, which was at the beginning of the presentation, but just reach out and let me know if you're interested. So let's talk a little bit about the public health position brief that we're working on. We've, over the past couple years, started putting together these position briefs, which you can see sort of the suite that we have available, the different topics, e-cigarettes, vaccines, health equity, gun violence, women's health, marijuana, climate change, which is finished, but we haven't formally put it out there yet because it wasn't really the right timing with everything happening with COVID. So we have that ready, but you won't find it on the website yet. And the importance of public health position brief, which we are working on now. And so the objective of this is really to showcase why public health matters, why we need to invest in the public health infrastructure as we rebuild from COVID, but also to strengthen it before the next pandemic hits. We're going to advocate for annual funding to pay for essential activities that you see here, and also talk about really what the experience of people working in public health is like during this pandemic, the costs involved, and really how we can be better prepared in the future. So we asked you on the Advocacy Alerts Forum what you wish you had now or in the wake of other public health emergencies to be better prepared. And we got some great responses. I'd also love to put that out to you again now, if you want to share, what are some things you wish you had now that would help you to deal with COVID and also help you be better prepared in the event of another pandemic. And here's what we heard from you. So we got a lot of great responses. I know there's a lot on this slide, but I just wanted to showcase really the variety of what we heard. Really understanding that public health is often on the chopping block when more pressing responses come up. So really making it clear what we do as public health professionals and sort of garnering that respect for the profession. Having a more coordinated effort amongst public health professionals, really talking about the cost in terms of dollars as well as lives lost, and how if we had a better infrastructure, we would save money in the long run. Really highlighting all the things that the public health departments are doing on top of handling COVID response with such small staffs, and how we're the silent workforce. The need for advanced technology to better predict, prepare for, and track disease outbreaks. And lastly, I really want to focus on this one that's highlighted in red. This quote really gets to the crux of the issue that's happening with COVID right now. This pandemic has not fallen equally across society. It has magnified crises that have always existed for people of color, especially Black people. And now more than ever, we really need to address these inequities. So this really leads into the next initiative, which is the subcommittee on racial justice and health equity that we put together. But let us know if there's anything that's not represented here that from your experience should be included in this position brief, because we'd love to include your thoughts. So thinking about what's happening in our country right now with COVID and the need for racial justice, really the common denominator is clear, it's racism. And these two quotes articulate it very well, much better than I can do. The first one, when a Black person dies of COVID-19, they have also and equally been killed by systemic racism. Racism is the original sin, an ongoing public health crisis that needs our attention right now. So we agree, and that's why we've created an advocacy subcommittee that's focused on racial justice and health equity. These efforts will be led by two of our members, Marlene Edmond and Araba Hassan. This is just getting started. We met earlier today. They have put together an amazing plan. They are eager to get started, have wonderful ideas. We will need a lot of help to really do the work that Marlene and Araba want to do. So again, let me know if you're interested in working on this subcommittee. You can put it in the chat or contact me for now, and I will forward it to Araba and Marlene. We're thinking about maybe getting an email so things can be more direct communication, but for now you can just send it to me or put it in the chat. I'm really excited about this initiative and the fact that NJSOPHE has the opportunity to guide the other public health organizations with these advocacy efforts. It's a really important step for us, and I'm really excited to support Araba and Marlene in these efforts. So as a start to this initiative, I thought it would be helpful maybe to try and start from a place of understanding, even just amongst our membership. So you'll see there's 2 questions here. If you're interested in participating, you can choose to answer whichever ones feel most appropriate to you. But I'd love to know either what do you seek to understand more completely, or what do you wish was better understood? So again, you can respond in the chat. But I feel like this will be an important input for our subcommittee to sort of understand where we're all at, what we're interested in, what sort of learnings are needed to help shape these efforts. So I'll pause for a moment. I know I've thrown like 12 chats at you already, and it's only getting started, so. Okay. Feel free to keep typing while I'm talking. But I want to move into just a few things that, right now you can do either to learn, support, or act. Ways that you can advocate for racial justice and health equity right now. Again, the subcommittee is going to have a lot more initiatives that you can get involved in. This is just really as immediate next steps, some things. And again, share your own ideas. But I love this illustration because it highlights, for one, the work that needs to be done to make change, but also that we're all in different places on our advocacy journey. And oftentimes advocacy is associated with maybe a loud voice or being at a protest, but there's so many different ways to advocate. Sorry, my phone's ringing. So these suggestions are organized into different categories of learning, supporting, or acting. So I encourage you to just recognize where you are right now and figure out what actions are most aligned to that place. So this is not meant to be an exhaustive list by any means. Again, the subcommittee will compile more resources and action items and have more webinars. This is just the start. But as we go through, feel free to share what are some things that have been helping you to learn, what are some organizations that you've been supporting, what are some things that you've been doing to take action. Please share your ideas and tips so we can capture them. Okay, so for some of us, the first step is learning. Understanding more about our history and systemic racism. If you're a white person like me, really understanding and acknowledging our role in what's happening, the biases that we have, and the privileges that we've been afforded as a result. So here are just some resources that could be helpful if you want to learn more or understand more about health equity as well. So there's books, there's podcasts, there's videos, and there's a more extensive resource list here at the bottom. These are not my ideas or my thoughts. So there's a really much more comprehensive list if you want to dig deeper into more of these resources. So here are some suggestions in terms of talking to kids about race and racism. Some of these are for adults to learn how to have these conversations, and some of these are to share with children as well. So in the share section, I don't know if you saw the Sesame Street Town Hall video, but that was wonderful. There's some great book lists here to share with kids. But an important part of learning is also making sure that we're educating kids as well. So moving into support, donating to social justice organizations, but not just donating, you know, following these organizations, signing up for more information. This is a great way to really keep abreast of what's happening and stay informed. So I tried to categorize these slightly by different issues. So racial justice, criminal justice reform, voting equality. I don't know if you guys saw the news about the Georgia elections yesterday, but really voting equality is going to be a key thing. So Fair Fight's a great organization to donate to or to learn more. Mental health access, reproductive justice, food justice, and supporting independent media. Supporting Black businesses. I was really struck by this Washington Post statistic that I read about the number of working Black business owners in the US decreased by more than 40% during the pandemic. You know, I know a lot of businesses are struggling right now, but this was a really staggering statistic for me. So diversifying your spending habits and seeking out Black businesses to support is a really good way to help establish equity. So here are some resources of places to shop, to eat, and even banks. And again, there's a much more robust list of action items for equality that you can look into as well. And moving into action. So here are some action items that you can take. NJISJ, New Jersey Institute for Social Justice, has some action items on their website. You can see I've circled here the different things you can add your voice to. Really easy, click on this link and it takes you to any of these initiatives they're working on, and you can add your voice and sign up to get more updates and more information. Making calls to legislators. As an introvert, this is not something I enjoy doing, but I do it because I know that calling legislators is one of the most effective ways to have your voice heard. Luckily, 5calls.org has made this a very, as painless as possible of a process. So you go to 5calls.org, you put in your location. I put in my location, which is Cranford, and then you click on what issues are important to you. So for this, I put in end corruption and defend voting rights. So you can sort of get a status of what's happening with this. I know it's passed the House, it needs a Senate vote. It tells me to call Cory Booker. It prioritizes the people that are most important to call. So call Cory Booker and even gives you a little script of what you can say. So really, a really simple way to break down. Sometimes it's can be daunting to call your legislator. So this is a great resource that focuses on things that are important to you and makes it easy for you. This is 8 Can't Wait, which is an initiative from Campaign Zero, which is another great organization to follow. And they have put together these 8 policies that can decrease police violence by 72%. So you can put in your location. I put in Newark, that was the closest city to where I live, and you can see how many policies your city has enacted. And then you can contact the mayor or the sheriff to let them know that you support these initiatives. So lastly, in this ACT section, I want to talk a little bit about, you know, not only advocating through organizations or donating or learning, but really speaking up and having difficult conversations with people in our lives. And we have to commit to having these conversations with people that we know, our family, our friends, or in our news feeds even, because if we don't, we're enabling them to spread inaccurate and potentially dangerous information. And if you think about it as public health professionals, as health educators, this is really part of our role to do this. And something that's helped me, I struggle with this, I will fully admit, something that's helped me is this last bullet, trying to sort of reframe the goal as not to win the argument or necessarily to change someone's mind or to shut them up, but really to come from a place of understanding and connection, and try and get them to continue the conversation and little by little open up to your perspective. So it's more of a longer term strategy than walking away feeling like you won the conversation, which, believe me, I love to do. So I'm working on this one as well. And these are universal strategies. They can be used to combat COVID-related misinformation or when talking about systemic racism, but really important to have these conversations. So a few tips when talking to close friends and family. Really thinking before you're going to have these conversations, preparing, what are the personal stories I can share? What are some data that might be helpful? And then having a plan in case you get upset, the conversation goes awry, you get overwhelmed. What are you going to do? Are you going to choose to pause the conversation, breathe, express your emotions, but just sort of being prepared for what you will do during this conversation. If you're responding to a Facebook post, maybe think about, if you know this person well, if it's friends or family, maybe it's a phone call, maybe it's a direct message or a text message, but really building that connection, a little bit more of a personal connection, and asking for consent, saying something like, I saw your Facebook post and want to talk to you about it. Is this a good time? To really invite them into the conversation. And then during the conversation, really trying to stay curious and again, trying to understand where they're coming from versus being judgmental, which again, I know is very hard, but trying to get to the emotional root of what is causing this person to feel this way, not necessarily be right. Trying to seek empathy and connection, and choosing the questions in a way that won't make the person feel necessarily defensive, which why questions can do. So some other questions listed here that may invite more conversation versus cause the person to get defensive and shut down. And Surge, Stand Up for Racial Justice, has a wonderful resource list on tips to respond to specific comments about racial justice. So, if you're hearing conversations about protests or violence, it goes point by point of things that you can say to respond. So it's a great resource that you can check out. And then a few tips for responding on social media. I love this first one. Respond in a way that doesn't suggest that the other person is foolish, naive, or gullible, even if you feel that they are. So even though you might want to say something like, how can you believe that crap that you're posting? A better suggestion would be, I've heard others talk about that as well, and I agree. These days, there's so much information out there, it can be hard to know what to believe. So again, coming from a point of empathy and connection. Trying to not make it personal and keep it professional. I like the idea of saying something like, as a health educator, it's part of my job to provide accurate information. Here are some data and information that might be helpful, or whatever your role is. But really, again, this is part of our job. So just making it part of our professional responsibilities. And then being brief. There's no benefit of going back and forth all night long. No one benefits from that. Just make a couple points and drop it, but don't let it go unchallenged. Again, if you have any best practices or tips, we'd love to hear them. Let us know. And lastly, why this matters. There's several things that you can accomplish by speaking up, even if you quote unquote lose the battle. Others can see you push back and they'll get information and see you calmly, maturely responding. When you speak up, it encourages other people to do so as well. And another great point is if they didn't know what to say, maybe they felt the same way, but they don't know what words to say or how to respond, they can copy and paste what you said and use that. And then lastly, it normalizes this information and it contributes to the exposure effect. So the more people are exposed to this information and these ideas, the more it will become familiar and credible. And it won't happen overnight, but the goal is to slowly have them open up to a different perspective. So I just want to end there, and I'll turn it over to Devangi in a second, but one last plug to join our efforts and join the conversation, share your thoughts. There's so many ways you can do that. You can do it through the Advocacy Alerts Forum. You can do it through LinkedIn, our Instagram, get involved in the message development, and help shape our racial justice and health equity efforts. And last thing I will say is, you know, there's so much happening in the world right now. You know, we all want to help, we all want to get involved. It's really important also to take care of yourself. And I know we have a webinar coming up on mental health and caring for yourself. And I just want to put a plug in to make sure that you're practicing self-care, because you cannot do any of this if you're not first taking care of yourself. So thank you.
Thanks so much, Tara. Devangi, if you want to share your screen.
Sure. All right.
Cool, we can see it.
Can you see the slideshow? Okay. Yeah, I'll do my first slide. Thank you, Tara. Thanks, Sonika. I am just going to get started. Hi, everyone. I feel honored to be joining you all today, and thank you so much for logging in on this beautiful day. We will be sharing the slides with you, so just sit back and get comfortable. All right, so I'm going to start out with current conditions in New Jersey. Working as a local government public health employee, especially at the local level, it has been very frustrating. Even more so lately than usual. We're witnessing all of these social determinants of health just bubbling to the surface because of COVID-19, and we're not really fully ready, fully equipped to deal with this, even still. So how are we going to deal with the coming weeks and even in the fall when things might be even more intense? So if you are feeling this way, it's one of the reasons is because we don't have any public health leadership at the state level. For example, the Deputy Commissioner of Public Health Services position is currently vacant during a pandemic. Our public health voice in this state is lost. So I'm going to talk a little bit more about that and why we need to be more aggressive and how we are advocating for public health in New Jersey. So state and local public health infrastructure system needs are not being prioritized, and Tara had touched on this a little bit. The focus should be on building up our existing public health systems. So we have hundreds of local public health officials right now that are working tirelessly behind the scenes, doing disease investigations and contact tracing, inspections, health education, risk communication, nursing, and they're not getting the resources and the support that they need. We need better communication systems, modern IT systems, more capacity. And most importantly, our most vulnerable populations are not being prioritized. We need public health leaders in New Jersey who are advocating for an equitable response during this pandemic. And to make matters worse, we are one of the lowest ranked states when it comes to state public health funding. And we have a broken public health emergency preparedness system, which has only been made worse by this pandemic. You will often hear the argument saying, well, we are a home rule state, so local government is in charge of making these decisions. But there are other states that are similar to us, Massachusetts and Kansas. So there are a lot of states that we can learn from to improve our public health system in this state. So I would like to show you what other professions and sectors are currently advocating for as it relates to COVID-19. I'm not going to go over all of these, but let's look at what the physicians are advocating for. They want liability protection, redesigning their electronic medical health record systems. They want to expand insurance coverage,
relief from regulatory burdens, student loan forgiveness for their medical students and residents. There are a lot of upstream and midstream factor issues that are being advocated for by these professions, especially mental health services, expanded insurance coverage options for employees, and financial support across the board. So where does that leave us? This is a public health framework. It's from the Bay Area Regional Health Inequities Initiative, and it's mainly showing the social determinants of health and the importance of working upstream. Now, I know I'm speaking to current and future public health professionals, so I won't go over social determinants of health with you, but we have been trained to look at these issues and identify root causes. And I use this infographic in my presentations, not only to community stakeholders, but also to governing leaders, because, you know, we are trained to ask the question, why is this happening? And to get to those root causes. And it's really those social inequities and institutional inequities. You know, that's where we need to focus our efforts. And so advocate to your governing leaders to look at these issues through a public health lens, even if you must do so subversively. So for example, even if you have to do a presentation on healthy eating or heart disease, injury prevention, or presenting morbidity and mortality data, include the big picture. And because we need to address New Jersey's needs as upstream as possible. So for example, I would like for you to look at your county health improvement and needs assessments and identify how many of these upstream factors are included in your CHAs and CHIPs. And I'm willing to guess not very many. So this is a problem statewide. And you know, this could be maybe an NJSOPHE project where, you know, we advocate for those upstream factors. And also as taxpayers ourselves, you know, we want our money to go towards more impactful upstream causes. And New Jersey needs to do better. So what should we be doing? We should be advocating to make public health a priority in this state. So how do we do this? By getting to the root causes, demanding attention on those upstream factors. So here's a start. This is an example of health equity when it comes to masking in Colorado. They have an Office of Health Equity, and they're doing amazing work. Due to COVID-19, we are seeing new policies and regulations that are much needed, you know, to protect ourselves and the people around us. But these policies and regulations can have and are having unintended consequences. They are negatively impacting people of color. So the Office of Health Equity in Colorado, they have done a great job in infusing equity, in this case, racial equity, into their messaging. They used a tweet from a gentleman who's experiencing these consequences. And they created a simple flyer and a post. They included his tweet, and you know, they had a statement that said, wearing a homemade mask, it is increasingly becoming the only option for many, can help protect ourselves and those around us from COVID-19. But for people of color, racial bias and stereotypes of criminality have created real fears about going out in public with this kind of protection. People of color have been removed from stores for wearing masks, and many fear for their lives. These communities are in a lose-lose situation: risk exposure to the disease or risk being racially profiled, or maybe worse. So in terms of advocacy, my question to you is, where's the Office of Health Equity in New Jersey? Do we even have one? Who is leading the effort to talk about and address these issues at the state level for New Jersey? So speaking about good leadership, which is what we need, here is a statement put out by APHA member and past president and founding CEO of the Asian and Pacific Islander Caucus for Public Health. She had a really great statement. It was very long, but I just wanted to show you the highlights. The takeaway here is that we must help contain the spread of COVID-19 through an equity and social justice lens. by using equity-oriented solutions. That is what we need in this state. So where does that leave us? You know, unfortunately, we are going to see many examples of social and institutional inequities as the pandemic evolves. Still, we can make progress if with every discussion of data, we can make the context surrounding COVID-19's disproportionate impact visible with real descriptions of what we as health educators and as public health professionals are witnessing and experiencing, and have that be connected to our public health values about keeping everyone in our communities safe and healthy. And when talking about these issues, bring history into the picture. Use tangible local examples of disproportionate exposure, less access to treatment, and pointing to policy either as a cause or solution. Think about ways to bring context to disparities in data around COVID-19. And you know, in New Jersey, I think we even have to talk about making sure that we're collecting that data, because that's not happening. And maybe using the Colorado example, there are so many barriers for all of the different types of policies related to the things that you see on your right, with masking, with access to testing. The people that need it the most are the last to receive it. And things are only going to get worse. If we experience a second wave or a bigger wave, we're going to have to make sure that we are doing this the right way. Even something as simple as temperature screenings. For many of us who drive to work in an air-conditioned car, we take a short walk to our air-conditioned building, temperature screenings might not seem like a big deal. But we are already hearing about workers that walk to work or bike to work, and by the time they arrive, their bodies are overheating, and so you know, again, they're going to be experiencing inequities here as well. So what are the solutions to be able to address this? And also, as public health professionals, you know, we are going to have to help balance regulatory enforcement with public health education messaging. That's going to be a key role for us as health educators. And it's going to be on us to make sure that we're incorporating equity issues into our response. Another good example is from the city of Boulder in Colorado. They actually had a declaration as part of their city resolution declaring that and encouraging community members to work together to focus on equity during their COVID-19 response. They also had the Colorado governor who established a COVID-19 health equity response team, and that's overseen by the Office of Health Equity. And you know, their goal is to tackle inequities to prevent the gaps from widening and ultimately saving lives. So if New Jersey had a similar COVID-19 health equity response team, and I'm going to just swap out what Colorado for New Jersey to sort of give us some hope of what that would look like. You know, if we had our own COVID response team, this is what they would say, that not all New Jerseyans are experiencing the COVID-19 pandemic the same way. There are factors at play for who gets tested, who gets treatment, who is able to practice social distancing, who is experiencing microaggressions, food insecurity, and housing concerns. During this pandemic, we are likely to see the loss of life from racial disparities, and action must be taken. We need to work with state teams coordinating resources and logistics to help curb health disparities related to COVID-19. We need to increase access to testing and care services for our most vulnerable, share time-sensitive information about how New Jersey communities are experiencing particular challenges related to the COVID-19 response, as well as future state emergencies. So there's a lot that needs to be done, and I think that NJSOPHE can play a major role in that. So, you know, stay tuned to learn more about how and what New Jersey needs and how we can move forward. What is the plan to ensure equitable resources, including funding to state and local public health? The boots on the ground who know their communities the best. They're struggling right now. How can we help them? And I know that we have some governmental public health folks on the webinar too. And so I know it's not easy for many of you. But if we work together and share information and resources, I think it's a step in the right direction. I also have some examples of current, critical vacancies at the Department of Health. That's something that shouldn't be right now. We need all the help and support that we can get. So if you feel very strongly about what's going on, not only, in the country, in the state, but in your community, we encourage you to volunteer, join a professional association, help us out on the board. Identify the challenges faced by you and your peers and share with us. Because I think what we need to do is we need to demand that, we need to demand formal commitment for the inclusion of public health and health equity, representation on state task forces and committees. So, stay tuned. And the American Public Health Association, they have an action alert right now. I think Congress was supposed to vote on this today. But this is really prioritizing public health in legislation to combat COVID-19. It's as simple as just clicking on the link, providing your zip code, your name and address. There are pre-populated messages that go out to your senators and Congress representatives. So I encourage you and urge you to do this if it's still available on their website, because I know that they were supposed to vote on this today. And here are some resources that you can use to, inform the materials that you're going to be creating, as well as materials that you can present to your governing bodies and your colleagues. And I think that's it from there.
Awesome. Thank you so much, Devangi. Okay, so we are at the hour exactly. We did really good on time. I just want to thank all of our speakers. So, Samantha, Suzanne, and specifically Tara and Devangi. I'm still wrapping my head around everything, but so much good information. Thank you for everyone who participated. The chat is amazing. There's so much good conversation going on, so many resources being shared. I know we could probably continue this conversation for hours, but thanks to everyone. We'll be sending out the presentation. If you have any questions, anything that wasn't addressed and you didn't put in the chat, or if you want to continue a conversation, reach out to any of us on the board, reach out to Tara, Devangi, any of us, and we'd be more than happy to continue a conversation or provide resources as needed. So again, thank you. I think the first session was such a success, and I'm glad that we were able to pull this off virtually.